Hello ladies and gentlemen, and welcome back to my channel. My name is Dr. James Gill, and you've joined me here today to look at the Ishihara charts and a little bit of colour vision. The Ishihara chart is used to determine if someone has a problem with their colour vision, or is colour blind, as this is often termed. Now, the Ishihara chart is a colour deficiency test, not a colour blind test, and I think that's a very important thing for us to highlight here. It's the most common test for looking at colour deficiency, but there are other tests available. Broadly, these are going to be things that are used to diagnose specific forms of colour vision, much beyond the red-green colour blindness. And for the vast majority of medical students and junior doctors, having a working understanding of the Ishihara chart should be sufficient. Let's put it this way. If the Ishihara chart isn't giving you the answer, then you need to get further help. So to be clear, the Ishihara chart is designed to look at congenital disturbances of colour vision, and that's probably a good place to highlight how common colour vision is. In chaps, you're looking about 1 in 12 people affected, whereas in women, because it's an X-linked genetic condition, i.e. women have a backup, it's much rarer. There we're looking about 1 in 200. So with that in mind, before we go on to look at how to use the Ishihara charts, I thought it might be a good idea to look at what colour blindness actually is. So normal colour vision is termed trichromatism, i.e. you're able to see the red, green and blue in their true forms. Away from trichromatism, the majority of colour vision deficiencies are actually red-green colourblind. There is a yellow-blue deficiency, but that is very rare and certainly not something we need to discuss today. Now, there are two types of colour division broadly. You have a Protan deficiency and a deuteran deficiency. Those are subdivided into two further categories. The Protan deficiency is split into Protonopia and Protonomaly. Essentially, we're looking at a total and a partial deficiency there. And it kind of makes sense therefore that we'll see the deuteran deficiency further split into a total and partial deficiencies, this time referred to as Deuteronomia or Deuteronomia. So what you really need to remember is that a Protan deficiency affects sensitivity to red light, and a deuteran deficiency affects sensitivity to green light. In terms of the subdivisions, when I say that Protonopia and Deuteronomia are total deficiencies of red or green, I mean in the absolute sense. These people cannot perceive red nor green, respectively. By contrast, Protonomaly and Deuteronomaly are more subtle. You've got degrees of an inability to perceive red or green. Essentially, it's a case of none versus some. So with Protonopia, these people have an absolute lack of red cones, thus they cannot perceive red, or more likely perceive it as black. Whereas Protonomaly, these people have some red cones, but they can become confused with colours, so they will often find browns and dark greens similar. Dark orange and dark red can be confused, and again some mid-greens will be confused with oranges, and we're certainly going to lose a subtlety and a contrast to those colours. Deuteranopia is the absolute loss of green cones and thus the loss of green colour, and when we have the milder forms, Deuteronomalia, that's going to mean mid-reds and mid-greens will look the same. Because of this, we can also have bright greens and bright yellows look the same. Pinks and light greys can look the same, along with mid-reds and mid-greens. Now, I highlight this Deuteronomalia because this is my colour blindness. To give you an example, I can't see holly berries on a holly bush until I get up close to them. Similarly, whilst preparing this video, I noticed that there is a plant pot in my office. It is grey as far as I'm concerned, but apparently Beth said it's pink. Similarly, I have a really nice bright yellow Lumos helmet that goes with my bright yellow cycling jacket. And I'm reliably informed that my helmet is actually green, but they look the same to me. So I've been very clear so far with this video that I've been cautious with my words. So saying that grey and pink can be perceived as the same, and that light green and light grey can be mistaken for the same. Okay. That's because we need to go back to the fundamental facts of how vision works, and light for that matter works. Let's just recap that now. A red apple is only red because the tissue of the apple absorbs all other light other than red, and that red is reflected back. So the red light is reflected off the apple, and thus we perceive the apple as red because it's the only thing coming to us. In a similar way, a red light is either a white light with a red filter on it, so only allowing red light to come out, or we're getting light from a source that will only emit a red light, such as burning strontium or calcium. There we go. I never thought my GCSE chemistry would come in useful, but what do you know? So this is why I've taken care to use the words appearance and perception when dealing with colour vision. Let's just quickly touch on the physics there. Visible red light is in the electromagnetic spectrum for 700 nanometers. We've kept GCSE chemistry happy, we may as well keep GCSE physics happy too. So this is an electromagnetic input that our eyes will perceive and stimulate the cones on the retina, and there we'll get a chemical response to that light. This chemical response, a neurotransmitter, is converted into an electrical signal and passed through the optic nerve to the occipital lobe at the back of the brain. And here we perceive that electrical stimulation as vision and colour. So once again, we've returned to that scenario that we, as humans, as mammals, are actually brains sitting sealed within a black box, vividly hallucinating the world around us based upon electrical stimuli that is coming into us. We will never see a colour or a light for that matter. What we will do is we will perceive the effect of that light when it hits our retina. So to drop a Matrix quote in at this point.
What's really going to bake your noodle later on is
your colour vision the same as my colour vision? Well, any of you who've seen my cranial nerve videos will know that I've touched on the Ishihara charts before, and I seem to have got them wrong. Well, that's because my perception of colour vision is a little bit broken, so quite possibly I don't see the world the same way that you do. Now, I think that's enough of an introduction to colour deficiency, but before we go into looking at my, possibly your colour vision deficiencies, I just wanted to ask something of yourselves. If you'd like me to deal more into colour deficiency, the genetics, the problems with the retina, the rods and cones and things, drop us a comment down below and we'll see about doing a video to look into what causes colour vision deficiencies in a little bit more detail. So, with that in mind, let's go back to our Ishihara chart plates that we started off the video with. It's important as far as the Ishihara plates are observed that we do it correctly. Ideally, we want to be having them observed by daylight, so by a window, or realistically, as in most clinics, a natural light mimic. A light that's too cold or too warm can cause colour deficiencies that aren't true. I mean, we all know what it's like when we've got our phone on night mode, we've got the warm background and everything's got a slightly orange hue. That will be the same as looking at the Ishihara charts with a too warm or too orange base light. When our phone is in night mode, the colours don't look right, and similarly, the Ishihara charts wouldn't look right under that light either. So make sure where possible we're using a natural light. Also, we need to have the charts 75 centimetres away from the patient and held up across their field of vision, not placed flat on the table. With that in mind, we're going to progress to the very first plate. Now this plate should clearly have the number 12 on it. This isn't a test of colour vision. As you can see, we're looking at sort of greys and oranges. What we are doing here is testing the patient's vision. If they can't see the 12 at this point, then there's no benefit in continuing on with the rest of the Ishihara test. What it does also do is highlight to people how they will perceive the shapes or the numbers in the test made up of the different dots and colours going forwards. When we use the Ishihara chart plates, we want to try and minimise the exposure the patient has to them. So we're going to give them the plates for 3 seconds and ask them to answer as quickly as they could. Now, medicine isn't black or white, you'll have to pardon the pun here, and thus we're going to score a patient on these charts. It's not pass or fail. What we will find is someone who scores over 17 is considered to have normal colour vision, while someone who scores under 13 has a colour deficiency that we'll be able to clarify later on. But what happened to scores of 14 and 16, I hear you cry? Well, there are some people who have very rare colour deficiencies that will be able to score between 14 and 16, but that's not something that can be diagnosed further with the scope of the Ishihara chart. We would certainly need more in-depth investigations, and we're not going to be able to look at that here. So with that in mind, under 13 is going to indicate a colour deficiency. Honestly, I think it's easier to show how the plates work rather than tell you. So with that in mind, let's get a pen and paper, or just anything to write with, and I want you to draw 3 columns, please. So with our little demo here, I'm going to show you again the first plate. If you can't see that, then I really think you should talk to your optician. On the bit of paper that you've got, I need you to score plates 2 to 9 in one column. We're going to score 10 to 17 in the next column and 18 to 21 in the third column. So let's have a look over those plates now. Please write down the numbers as you perceive them as we go along, and then we'll top them all up at the end. So for column 1, everybody should be seeing number 12 on plate 1. Plates 2 and 3. Plates 4 and 5. Plates 6 and 7. Plates 8 and 9. So that should complete the plates for column 1. Okay, so let's go through the answers in inverted commas to those plates. So we all know that plate number 1 was our control, so we've all seen 12 there. On plate 2, if you had normal vision, you should have expected to see the number 8, whereas some with red-green deficiencies may have seen 3. On plate 3, a normal person would see a 6, whereas people such as myself would see a 5. On plate 4, a normal person would visualise the numbers 29, whereas here the red-green colour-blind deficiency is going to show up with the number 70. Again, we're changing more again. On plate 5, a normal person would see 57, whereas those with red-green deficiencies would see 35. Plate 6 would show 5 in a normal person and 2 if there's a colour vision problem. Plate 7 would show 3 for a normal person and 5 with colour deficiency. Plate 8 would have 15 for normal individuals and 17 if there's a colour vision problem. Plate 9 should have 74 seen with normal vision and 21 with red-green colour deficiencies. We're going to column 2. Plates 10 and 11. 12 and 13, 14 and 15, 16 and 17, now we asked you to go over to the second column here for plates 10 to 17. This is because here people with colour deficiencies should not have been able to see anything. So on plate 10, a normal person would see 2. Plate 11, they would have seen 6. Plate 12, they'd have seen 97. Plate 13, they'd see 45. Plate 14, they'd see 5. Plate 15, there'd be 7. Plate 16, they'd perceive the number 16 as well. Plate 17, they'd perceive 73. (18) and 19, 20 and 21. And now we're going to flip the tables. For those of us with colour deficiencies, we should see something on plates 18, 19, 20 and 21, whereas those normal vision people wouldn't see anything. On plate 18, I'd expect someone with red-green colour deficiencies to see the number 5. On plate 19, they'd see number 2. On plate 20, they'd see 45. And on plate 21, they'd see 73. So having completed those plates, we should know whether or not you've got any problems with your colour vision. If you've scored over 17, congratulations, your vision's normal. If you've scored 13 or under, welcome to my colourblind club. But if you are in my club, we now have to do some additional tests. So we're going to go forward now to look over plates 22 to 25, and they're going to determine what type of colour vision we have. However, this isn't just for those of us with colour deficiencies. Those who have trichromia, so normal colour vision, can also look at those plates because you will perceive different numbers from us. We're going to do the same again. We're going to show you the plates only for a brief 3 seconds, and I need you to write down what it is you see as clearly as you can see them. 22 and 23. 24 and 25. So these plates 22 to 25 will allow us to determine whether or not you have a Protan colour vision deficiency, i.e. a problem with the red cones, or a deuteran colour deficiency, i.e. a problem with your green cones. So on plate 22, a normal individual would see 26. So if you had a red deficiency, i.e. a Protan type deficiency, a strong signal would be seen for the number 6. But if you had only a mild colour deficiency in red, that would show a weak 2 and a stronger 6. If you had a deuteran or a green colour deficiency, on plate 22 we'd have expected a strong 2, and a mild colour deficiency would have a strong 2 and a very weak 6. On plate 23, a normal person would see 42, but the Protan, a red deficiency, would have a strong 2, and if it's a mild red deficiency, we'd expect a weak 4 and a strong 2. A deuteran deficiency, so green colour deficiency, would have a strong 4, and if it was a mild green deficiency, we'd have a strong 4 and a weak 2. On plate 24, a normal individual would see 35, with a Protan red deficiency, if it was a strong deficiency, would show 5, with mild having a weak 3 and a strong 5. So the deuteran type green deficiency would show a strong 3, and if it was a mild deficiency, would have a strong 3 and a weak 5. Our final plate there, plate 25, a number 96 would be seen with normal vision. Our strong red deficiency would show 6, and our mild red deficiency would show a weak 9 and a strong 6. Our strong green colour deficiency would show 9, and our mild green colour deficiency would show 9 with a weak 6. Well, that's completed the Ishihara chart. Let's have a look what's actually happened. So, as we said, if you've scored 17 or over, you're fine. If you've scored under 13, you've got your colour deficiency. And we've asked you to look at plates 22 to 25 to determine what's going on with the colour deficiency. Well, there we go. So that wraps up how to use the Ishihara charts and a bit of a background on colour vision deficiencies. If you found it useful, please consider subscribing to the channel and please give it a like so that YouTube knows that we're here. With that in mind, I'll say cheerio and we'll see you in the next one. Take care all.